Hello, welcome to this training session for SmartEP Electrocochleography by Intelligent Hearing Systems. Today, I will walk you through the patient and software setup for performing and analyzing an eCoG test. eCogs is an objective test measurement of electrical potentials generated in the inner ear and the auditory nerve in response to sound. There are three eCog components: the cochlear microphonic, the summating potential, and the action potential. The cochlear microphonic arises from outer hair cells in the cochlea. The summating potential arises from the cochlea with major contributions from the inner hair cells. The action potential is generated by fibers in the distal or cochlear end of the auditory nerve, the eighth cranial nerve. The eCog response is recorded using an electrode placed in the ear canal, such as a Tip-trode, or on the tympanic membrane, such as a Lilly TM-Wick electrode. The first synchronized firing of the neurons, as displayed in this graphical representation, generates the action potential. The peak is referred to as AP. It is also known as the peak 1 component of the auditory brainstem response, the ABR. The summating potential, also known as the SP component, results from the contribution of both inner and outer hair cells of the cochlea. The latency of the AP will depend on the intensity level as well as the frequency of the stimulus. So what are the clinical applications of eCog measurements? Electrocochleography is used primarily to diagnose Meniere's disease and endolymphatic hydrops. Meniere's symptoms include but are not limited to vertigo, hearing loss, tinnitus, feeling of fullness in the ear. Symptoms are episodic, periodically decreasing and increasing over several months and years. Other clinical applications include intraoperative monitoring. In these cases, surgical operation on brainstem or cerebellum may bear risk of damage to the auditory system. Therefore, eCog recording during surgery assesses the functional integrity of the peripheral and brainstem pathway directly during operation. Clinicians also use eCog measurements to help in the identification or enhancement of wave 1 of the ABR recording. eCog recordings have also been found to help diagnose auditory neuropathy, where you can test for hair cell function and the cochlear microphonic to determine if a problem arises in the synapse at the base of the inner hair cells or if the issue is the auditory nerve. The ability to provide information on where the dysfunction may lie within the auditory system is valuable. There are various electrode options to choose from based on site placement. First option is in-ear canal electrodes, typically referred to as Tip-trodes. The second option is tympanic electrodes, which sit on the tympanic membrane. IHS supplies the Lilly TM-Wick electrode. And the third, most invasive type of electrode is the trans-tympanic needle electrode. This electrode transverses the tympanic membrane. For the purpose of this presentation, we will be discussing the first two options. Shown here is the Tip-trode option. The Tip-trode electrode cable and sound tube shown on the left consist of three main components. The sound tubes used for sound output are color-coded as a red tube, which will be connected directly to the right ear insert earphone speaker, and the blue tube, which will be connected directly to the left ear insert earphone speaker. The lead cables are also color-coded. The red lead cable will capture the right ear auditory evoked response signal, while the blue lead cable will capture the left ear auditory evoked response signal. The last component is the tip of the Tip-trode cable, where the gold foil insert foam ear tips will be placed. Once the ear tips are slid into place on the tip of the Tip-trode, the clinician will clamp down on the clasp to ensure that the cable is in good contact with the conductive gold foil wrapped on the ear tip. It is this connection that will transmit your response to the IHS amplifier. Once a connection is confirmed, then the gold foiled ear tip is prepped with conductive gel. You can use either SpectraGel or 1020 paste as the conductive gel paste on the surface of the Tip-trode. Ensure that the gel does not occlude the ear tip sound output opening. Then the Tip-trode ear tip with sound tube is inserted in the ear canal. It is important again to note that when using Tip-trodes, sound tubes need to be connected directly to the insert earphone speaker boxes. Do not attach the Tip-trode tubing to the tubing already on the insert earphones, as this will increase the tube length, leading to an attenuation of sound and will reduce the amplitude of the response, as well as increase your latencies. You will need to remove the standard sound tubes from the insert earphones in order to use the Tip-trode cables. Tip-trode ear tips are available in two sizes, 10mm and 13mm, as shown here. The second option for recording eCogs is the use of tympanic electrodes. Intelligent Hearing Systems is pleased to offer and manufacture the Lilly TM electrodes. These non-invasive electrodes sit at the tympanic membrane, allowing for the collection of more robust and repeatable electrocochleography responses. The Wick option is the perfect compromise and the smart choice between the invasive transtympanic electrode and the non-shielded, further away from the site of generation, in-ear canal Tip-trode electrode. The eCochG pack comes with a companion shielded electrode cable. This cable is manufactured with industry-standard electrode lead connectors and makes the Lilly TM-Wick compatible for use with SmartEP and other manufacturers' eCog recording equipment. The Lilly TM-Wick electrodes make eCog acquisition, measurement, and analysis simple. They are easy to place and allow for electrode placement closer to the generation site of the response. The proximity to the site of generation results in larger repeatable amplitude responses. The shielded electrode connection allows users to acquire responses that are less contaminated by noise, as compared to responses acquired with traditional non-shielded Tip-trode electrodes. For the purpose of this video, we will proceed with an eCog TM setup and testing, but similar setup and concepts apply to the Tip-trode option as described earlier. To begin preparation of the patient for testing, conduct a thorough otoscopic examination to determine if there are any contraindications for use of the Lilly TM electrode. The ear canal can be cleaned by a certified clinician, as impacted serum can prevent the proper ear assessment. Do not use this electrode on patients with skin allergies or patient whose tympanic membrane is compromised. Place a drop of saline on the tip of the wick to rehydrate the TM electrode. Wait about 15 minutes until the saline solution works its way onto the silver chloride electrode lead cable. You can enhance conductivity and lower impedances by adding or dabbing a small amount of conductive SpectraGel on the end of the TM-Wick before inserting it in the ear canal. Now let's discuss placing the TM-Wick in the ear canal. It is important that this be cautiously done by a trained and certified professional. Carefully and slowly insert the TM electrode in the ear canal. The patient will feel some fullness and pressure when you have reached the tympanic membrane. Pull back slightly to leave a gap between the wick and the tympanic membrane. It is very important to note that inserting the foam ear tip will naturally push the TM-Wick forward towards the tympanic membrane. Therefore, it is extremely important that you have established a space or gap between the wick electrode and the TM when initially inserting the TM-Wick electrode in the ear canal. Secure the wick electrode to the face with a surgical tape. Then insert the sound tube with foam ear tip. The goal is to place it comfortably and as close to the tympanic membrane or the site of generation as possible without causing any harm or discomfort to the patient. Thus, use extreme caution during this procedure. Make sure the foam ear tip is pressed flat before inserting it into the ear canal. The foam will expand once in the canal, and it will act as an anchor to keep the wick electrode in place. Please note that insertion depth may affect the quality of your recordings. Next, choose your electrode montage. Most clinicians will choose to use a single channel horizontal array to acquire the eCoG response. The polarity matching between the patient's electrode site connections and the device amplifier connections will govern the way that the peaks of the response will be displayed on the SmartEP software screen. If you prefer to view eCoG responses as negative downward peaks, then the test ear electrode would be connected to the positive non-inverting input of your amplifier or patient cable, and the contralateral ear canal or mastoid would be connected to the negative inverting input of your amplifier and patient cable. On the contrary, if you prefer to view the eCoG response as upward positive peaks, then the test ear electrode would be connected to the negative inverting input of your amplifier patient cable, while the contralateral ear canal or mastoid will be connected to the positive non-inverting input of your amplifier patient cable. Some clinicians choose to acquire an ABR immediately following an eCoG, or an ABR and eCoG at the same time using two different acquisition channels on a two-channel system. For example, channel A may be set up with filters to acquire an eCoG, while channel B is set up with filters to acquire an ABR, or vice versa. Both channels are designated as on in these cases. For these types of setups, clinicians have opted to use the same ABR ipsilateral montage as shown here to acquire the eCoG response. When using an ipsilateral montage, the test ears or TM-Wick or Tip-trode electrode leads are connected to the negative inputs of the amplifier or patient cable. The positive high forehead surface electrode would be connected to the two positive inputs on the amplifier or patient cable using a Y adapter, while the low forehead surface electrode would be connected to ground. Please note that this setup will result in positive or upward peaks. In the SmartEP software, there is a feature to invert recordings if the peak inflections are displayed in the opposite way from what is desired. This feature can be found in the process menu under Invert Active Recording. Let's review the Opti-Amp connections for a right ear single-channel eCoG using a horizontal array. This will result in upward positive displayed SPAP response. We will cover the Duet patient cable connection shortly. Connect the TM-Wick electrode to the Wick cable. For positive upward peaks, the red portion of the Wick cable is connected to the negative input of the channel you are acquiring from. Typically, channel A represents the right ear. Thus, a TM-Wick cable coming from the right ear would be connected to channel A negative, the red input. The shielded grounding black extension of the Wick cable is then connected to the ground input of the preamplifier. The ground surface electrode lead from the forehead, when using a horizontal array, would be stacked on the top of the Wick shielded grounding connection. Lastly, the surface mastoid blue snap electrode lead, as shown in the picture, is connected to the positive input on that channel. Use a Y adapter to short out the other channel not being used. If you have another eCoG electrode, such as a Tip-trode or a TM-Wick, in the non-test ear, then that electrode cable would be connected to the positive input of the channel being used for testing. When a second Wick cable is being used in the non-test ear, you will find that you have an additional grounding extension cable. You would stack this ground extension into the amplifier's ground input connection. Lastly, for negative downward response peaks, simply reverse the polarity connections between the test ear and the non-test ear. To test the other ear, repeat the process, but make your connections on channel B. Where test ear is left negative, channel B. Non-test ear is left positive on channel B, and ground is the forehead. Now let's repeat the same example by using the Duet patient cable for those of you using the Duet platform. You will need to use the 5 electrode lead patient cable, part number M010332 for eCochG testing. Connect the TM-Wick electrode to the Wick cable. For positive peaks, the red portion of the Wick cable is connected to the negative input of the channel that you are acquiring from. In this example, we are setting up to test the right ear with a horizontal array. The right ear response is acquired from channel A. Thus, the TM-Wick electrode cable would be connected to the red negative input on the Duet 5 electrode lead patient cable. The shielded black extension of the Wick cable is connected to the ground. The ground electrode lead would be stacked on top of the Wick shielded connection. Lastly, the white snap lead coming from the left ear mastoid surface electrode is connected to the positive white input connection on channel A. If you have another eCochG electrode such as a Tip-trode or a TM-Wick in the non-test ear, then that electrode cable would be connected to the positive input of the channel being used for testing. When a second Wick cable is being used in the non-test ear, you will find that you have an additional grounding extension cable. You would stack this ground extension into the ground connection on your patient cable. Lastly, for negative downward response peaks, simply reverse the polarity connections between the test ear and the non-test ear. Now to switch ears and test the left ear using a horizontal array with positive upward peaks, you would make the following connections. The Wick cable from the left test ear would be connected to the blue negative input on the patient cable. The shielded extension of the Wick cable connects to the ground, with the forehead ground lead stacked on top. And the electrode lead from the right ear mastoid or ear canal would be connected to the gray positive input on the patient cable. Next, check impedance. If you are using a preamplifier setup, then impedance is checked by rotating the dial to each impedance check position. For the Duet platform or any platform with a direct patient cable to device connection, impedance is checked in the SmartEP software. Please note that after you have completed testing, you should disconnect the lead wire and discard the single-use electrodes. Now let us review some typical eCochG recording acquisition parameters. First, we will begin with the stimulator selection. The transducer will be set to insert earphones. We will be outputting a 100 microsecond duration click. Intensity ranges from 80 to 95 dB NHL. Polarity is typically alternating, but this will reduce or cancel your cochlear microphonics. Thus, if you're interested in acquiring a cochlear microphonic, then you will need to acquire in both rarefaction and condensation polarities. 2 rates can be used. A slow rate is used to enhance the AP component, and the fast rate is used to differentiate SP, which should remain robust as compared to the deteriorating AP at a fast rate. Some examples of slow rates are 7.1, 7.3, 7.5, 7.7, 9.3, and an example of a fast rate is 99.3 per second. As far as averages or sweeps are concerned, you should acquire at least 500 sweeps as a minimum, knowing that more averages, the better your signal-to-noise ratio will be. Some typically will acquire between 512 and 1,024 sweeps per recording. And then between 3 to 4 recordings are typically collected for verification and grand averages on each ear. The acquisition time sampling rate is 25 microseconds or 12.8 milliseconds, but the display analysis window is set to 5 milliseconds. Regarding the gain, we typically use 100K, but for some, there is a choice to do 50K. If the response is very large, you might want to lower that gain. Filter settings is 10 to 1500 hertz. But if you, again, are interested in acquiring a cochlear microphonic, you must acquire to 3000 hertz. Notch line filter is set typically to none unless you have large amounts of 60-cycle noise present in your environment. Now let's review how to create a settings file that will store all acquisition parameters and display settings. Creating these files only needs to be done once. Once this user-defined file is saved under Save Settings on the control panel, it can be loaded each time an eCog test is performed via the Load Settings option. To begin the creation of a new settings file, click on the Protocol menu, select Modality, then Auditory, then the eCog option. The software will prompt if you would like to default to the standard settings for the selected EP. Click and select Yes. You will see the time base has changed to a 5 millisecond display window for eCog recordings. Other settings pertaining to eCogs have also been loaded. If you want to change the intensity, double-click on the intensity button and enter the level you wish to begin testing at. All other test parameters are shown here in the control panel and can be accessed by clicking on the selection button. To view or change the gain, high pass, and low pass filter settings, click on the amplifier button. For two-channel systems, you will see two channel selections. Channel A is designated as the right channel and Channel B is designated as the left channel. In this example, I am creating a settings file for testing the right ear only. Thus, I will change the designation of Channel B from left to off and select OK to register the change. Now, let's click on the display parameter menu called Set Page. Here, you can change the scale from an absolute value to a dynamic changing one by selecting Normalize Page, where the data will be scaled according to the largest peak-to-peak amplitude recording displayed. You can also change the plot size or zoom percentage of the displayed recordings, and your scale at the top left-hand side of the screen adjusts accordingly. To save the settings file, click on the Save Settings button on the control panel and enter in the settings file name and click Save to save the file. Please note these files will have SET file extensions. Now, let's create the settings file for the left ear. Click on the ear button on the control panel and toggle it to left ear. Then, click on the amplifier button and set Channel B designation back to left and set the Channel A designation to off. Click OK to register the change and then click on Save Settings and name the settings file for the left ear and select Save. These settings files are now accessible for testing through the Load Settings button on the control panel. To acquire, simply click on Acquire button on the control panel. Once eCog recordings have been acquired, you will want to obtain a grand average of the results. To do this, make sure the addition mode is set to sweep weighted via the process menu. Click on the first recording handle until it is filled in black and the recording has turned green or active. Press and hold the Control key on your keyboard and select all other recordings you wish to add or sum. As they are being selected, the handle circle will become gray. When all recordings you wish to add together have been selected, press the Shift key and the plus key together. The summed recording grand average will appear on top as a new active bold green recording. Use your up and down arrow keys to move the grand average to a place of your liking on the screen. Select the Recordings menu and choose Save Active Recording to save the grand average and assign it a file name. In the Recording Information panel, you will see the addition of the recordings selected shown in the comment section. SmartEP provides easy-to-use labels and automatic measurement of SPAP ratios once peaks have been labeled properly by the clinician. The labels available for eCog include CM for cochlear microphonic, the bass, SP for summating potential, AP for action potential, peak 3 if you are displaying the ABR with the eCog, and peak 5 of the ABR as well. As you can see displayed here, 4 recordings were acquired and then summed into one grand average. The grand average displayed without any shaded area is labeled as traditionally labeled with only the amplitude ratio. The grand average with the shaded area is labeled with both amplitude and area ratio measurements. The last recording display simply shows an inverted grand average and the option to add side text to the recording displayed. The traditional and original way to obtain an eCog measurement is to label the AP, SP, and bass and obtain the amplitude ratio between the summating potential and the action potential. Now let's review in the software how to label the amplitude ratio. Click on the grand average obtained. Click on the bass label in the shortcut toolbar and the bass label will turn red. Then place it above the green active waveform where the bass is located. Select the SP label from the toolbar and click above the recording where the SP is located. Finally, select the AP peak label from the toolbar and click on the recording where the AP is located. Next, drag each amplitude marker, the arrow pointing upward at each AP and SP peak label, to the base. You can select to show text on the side of the recording and view the amplitude ratio measurement as shown here, listed as amplitude ratio or AR 0.28. Now let's review amplitude ratio analysis. On the left, we see a normal eCog response and SP-AP amplitude ratio. To the right, we see an abnormal eCog where the SP rides higher on the AP peak. An increased SP-AP amplitude ratio is typically indicative of a pathological condition. It is important to note that eCog amplitude ratio analysis is dependent on the type of electrode used and how close the electrode is able to get to the site of generation. For ear canal electrodes, such as Tip-trode electrodes, the normal range is 0 to 0.5 or up to 50%. Above 50% is abnormal. If a TM electrode is used, such as the Lilly TM-Wick, then the normal range is 0 to 0.35 or up to 35%. Above 35% is abnormal. Lastly, if a promontory transtympanic needle electrode is used, which would get you closest to the site of generation of the eCog response, then the normal range is 0 to 0.30 or up to 30%. Above 30% is abnormal. Another eCog measurement is the area ratio analysis, also referred to as the area under the SP-AP curve. As eCog measurements and interpretations have been studied and developed, the work of Dr. John A. Ferraro has shown that this new measurement approach of calculating the area of the SP-AP complex provides valuable information in the interpretation of the eCog recordings. This area ratio measurement analysis approach has been incorporated into the SmartEP program version 5.2 and above. If you would like to always calculate the area ratio, then you will need to save this option once activated as part of your eCog settings file under Save Settings. If the eCog response was acquired with SP-AP positive upward slope morphology, yet you prefer to calculate the area ratio with a negative downward slope display, then invert the sum recording via the process menu Invert Active Selection to flip the waveform. Now let's proceed to the software to see these steps in action. First, right-click on the summed recording grand average and select Mark Other Peak. Place a check mark next to area ratio and click on X to exit. Label the base of the SP, which occurs at about 0.3 to 0.5 milliseconds post the onset of the stimulus. Move the base amplitude marker to the other side of the SPAP complex, where the waveform returns to the baseline. Make sure your amplitude reading on both sides are the same in order to register a 0 microvolt amplitude baseline. This means if you mark the base at 0.3 milliseconds and the amplitude of that point is X, please see the amp value in the information bar for guidance. Then, the amplitude marker for the baseline should be placed at the same X amplitude on the other side of the SPAP waveform complex. This will register a straight line across the SPAP waveform with a 0 microvolt amplitude for the baseline. Next, mark the SP peak and click and drag its amplitude marker arrow to the baseline label amplitude marker. Finally, mark the AP peak, then move the amplitude marker for this peak to the same baseline labeled amplitude marker. All three amplitude markers should line up on top of each other. If they do not, you can use the Alt and arrow keys to move the amplitude markers until each label lines up together. The area ratio will appear on the screen and the amplitude ratio will be provided on the printout or in the label information of the recording. Here's some guidance on interpretation and analysis of area ratio and amplitude ratio as described by Dr. John Ferraro when labeling using the area ratio technique. eCoG results are considered normal when the area ratio is in the range of 0.8 to 1.8. Area ratios greater than 2 are considered abnormal. For amplitude ratio analysis, the average amplitude ratio is around 0.25 or 25%, with a range of 0.10 to 0.45 or 10% to 45%. Amplitude ratio greater than 40 to 45% for a 90 dB click is abnormal, especially if that difference is more noticeable and considerably larger when compared to the normal ear. Ultimately, clinicians are responsible for the interpretation of the eCoG responses. Please note, the purpose of this video is to demonstrate software operation of the SmartEP eCoG modality. For clinical guidance, please refer to the literature and other professional resources. This concludes the SmartEP eCoG modality training, a component of our complete line of applications. We hope you've enjoyed our presentation. If you are not currently a Duet user, please contact our sales team at sales@ihsys.com for more information on this innovative clinical solution. Thank you for watching this training video. If you have any questions or suggestions, please contact our support team at support@ihsys.com.